The NHSC is big enough to be impressively impactful, but small enough to be nimble.
For me, there is this great excitement about being able to impact a community.
You'd be amazed the satisfaction, the gratification you get by treating some of these patients, because a lot of them, they don't have another option, you know?
We provide a service to our people that would otherwise not be available.
A lot of my family are underserved. They're from rural or very urban inner city communities where the access to healthcare is not good.
Being able to come back to my hometown, I felt that by understanding the cultural barriers, I could help many, many people to not be as afraid of the dentist.
It just seemed natural to me that I would try to provide primary care to people who don't have the means to be able to afford other clinics.
The National Service Corps started in 1972, and the big idea was to have clinicians go into rural, underserved, tribal areas to provide much-needed services, ranging from primary care to family medicine, OB-GYN services, et cetera, the full range of clinical services to those communities. Many of us are drawn to medicine originally for that calling, that desire to help others, right, fundamentally. The National Service Corps hasn't lost sight of that. That is the purpose of the program. It is, yes, we give loan repayment or we give scholarships, but really the intent is to afford clinicians an opportunity to live that aspect of healthcare that called to them originally.
The healthcare system wasn't working quite very well. Why not have some of the doctors and dentists and so on working in the public health service, work in communities where there was a need? When I then found this manpower report that provided data on the maldistribution problem of health personnel, I spent the next 2 weeks writing a proposal, using the data and explaining the justification and how easy it would be.
Those ideas became a reality when Congress passed the Emergency Health Personnel Act of 1970. And in 1972, Dr. Hubert McDonald Rimple was appointed as the first director of the NHSC. Within 6 months of its initial operation, 181 clinicians had been placed in more than 100 communities. By the end of the decade, it had grown to over 1,800 providers, and the budget had increased tenfold.
I felt as though we were doing something very, very important. On the phone with physicians, hour after hour after hour, talking with them about prospective locations, what we thought the experience was going to be like, but much of it was a sense of passion for the opportunity to provide healthcare where it was otherwise not available. I learned very quickly in NHSC what that maldistribution resulted in. Communities with practically no access.
Practice in the backwoods of Maine has been a revelation for Joe Viglotti. Here he lives among the people he cares for. He's the first of 600 medical personnel being assigned to 120 communities throughout the United States in the new National Health Service Corps. When they applied to Washington to send a doctor, the people of Jackman would have settled for any qualified doctor. With Monique and Joe Viglotti, they got a team who served the community with high professional competence and dedication.
To expand on its inaugural scholarship program, in 1987, the NHSC established the Loan Repayment Program, which provides awards to healthcare professionals committed to service in health professional shortage areas. The program became a recruitment and retention tool for NHSC-approved sites, attracting eligible providers to areas they might not have considered. The State Loan Repayment Program is also added to support clinicians working in their own underserved communities. The NHSC Revitalization Act of 1990 expanded the scholarship and loan repayment programs and reauthorized the NHSC for an unprecedented 10 years.
Our goal was to have a workforce in America that were serving underserved communities that reflected the communities that we were privileged to serve. The National Health Service Corps continued to look for ways to meet the needs in urban, rural, and frontier underserved areas with interprofessional teams. So we expanded the number of disciplines that were covered. The other thing that we've worked closely to do was to look at retention with a broad scope.
By the beginning of the millennium, the NHSC prepared to face new challenges and added mental health to the loan repayment program as a new, much-needed discipline. 2002 marked the first 30 years of the NHSC. During this decade, the NHSC doubled in size, with nearly 14,000 health professionals practicing all over the U.S., including in more than 1,900 rural counties. The NHSC received permanent reauthorization through the Patient Protection and Affordable Care Act of 2010 and expanded its Students to Service loan repayment program, adding more dentists to the health workforce. Additionally, telehealth's inclusion as a service credit option increased rural access to quality care. Then, in 2015, the NHSC responded to a new public health epidemic, the Zika virus. During the Zika epidemic, the Corps was able to quickly expand its loan repayment program to help communities desperate for health care support for an unprecedented crisis. In 2018, to combat the nation's emerging opioid crisis, the NHSC launched 2 new programs to recruit clinicians trained in behavioral health and medication-assisted treatment protocols, and added substance use disorder treatment facilities to its list of eligible site types.
A lot of our clients are dealing with their homelessness by using substances. In the past 2 years, we've seen an influx of clients that are coming in with an opioid use disorder.
When there have been national emergencies, NHSC has changed and allowed funds to get appropriated to be responsive to the crisis of the day, while still maintaining the backbone of the Corps that has existed since its inception.
2020 brought new health challenges to the entire world, with the first global pandemic in more than 100 years. And NHSC clinicians were right there, helping on the front lines with testing, and when they became available, vaccinations. And today, as in decades past, the NHSC's health professionals are addressing the lack of maternity care access in rural and other areas with high OB/GYN provider shortages. With recent reports indicating an increase in maternal death rates, especially among minority and rural populations, the NHSC is again expanding its loan repayment program to further support the distribution of NHSC maternal health care professionals to communities where they're needed most. Our providers make a difference in the lives of mothers and their babies and gain invaluable healthcare experience wherever they serve. In 2021, the NHSC grew to a record nearly 20,000 members, serving at more than 10,000 community health centers nationwide, where patients are seen regardless of their ability to pay. NHSC providers treat almost 21 million patients annually, and a third serve in rural communities, where healthcare access may be limited or require patients to travel long distances to receive treatment.
Primary care is kind of the lost art, especially in rural healthcare. So I'm glad that I can help fill that need in the rural healthcare area.
The NHSC continues to be the nation's top program to support qualified health professionals while connecting them with underserved communities that welcome and need them.
I have the most impact on the people that need the most. They need me here, and as much as they need me, I actually have felt like it's a two-way street here. I felt like they have enriched my experience not only as a physician, but also as a member of the community.
I was very fortunate to have that experience and connection to the Yappies community. They adopted me when I was there and was given a Yappies name, Yobumem, which means our gift.
Last 50 years, over 66,000 graduates from the program, going to a wide array of sites, clinical environments, rural, underserved, tribal. Prisons has also been an environment. In that time, you've had scholars who have gone on and completed their obligation and held very high positions in government, in industry, been leaders of hospitals, been assistant secretaries of health. now leading efforts in the CDC. So what you see is not only clinicians who have graduated from the program, alumni, but have gone on and contributed and really furthered their career in the blending of public health, the delivery of care, primary care, and in other areas.
With changing public health issues and the need to continue strengthening our national health workforce, the National Advisory Council on the National Health Service Corps continues its work making policy and program recommendations and identifying program priorities.
The opportunity to serve on the council is advocacy at one of the highest levels because of your ability to use your scope of influence and your expertise to really contribute to the greater work of the National Health Service Corps.
50 years strong and growing, the NHSC's story continues its focus on recruiting and retaining the next generation of primary care providers, health professionals who will impact the nation's healthcare landscape, leaving as large or greater a footprint as those NHSC members before them.
I mean, it was life-changing. I think that if there had not been an NHSC, I think there was a good chance I wouldn't have been able to complete medical school.
You may not be able to change the world, but you can change the world of every person that you interact with. And as an NHSC clinician and a provider, you can absolutely do that.
To learn more about the NHSC and join in the celebration, visit nhsc.hrsa.gov/anniversary.